the moment our head hit the ground to right now, every second up until this point matters. In a situation like this, time is of the essence. According to a study published by the Journal of the American Medical Association, just a 5-minute delay can increase the odds of death by nearly 46%. In this tragedy, there are 3 main problems. Number 1, the response time of an ambulance coming to the rescue is extremely slow. And number 2, even more time will be used for the doctor to really understand the patient's condition. And number 3, in extreme and severe cases, the patient might die because the treatment was not efficiently administered.
Let's take a step back and analyze how a medical emergency like this would be solved today. First, a bystander would call 911 and the ambulance would come. Then the patient would be admitted to the ER, but by now a lot of time has already been used. After the ambulance finally arrives to the hospital, the paramedics must convey the status of the patient to the ER medical staff with a full, detailed medical report. But what if we could eliminate this step? The medical report and condition of the patient was sent to doctors beforehand, so no time was wasted, and once the patient was taken off the stretcher, the doctors could immediately start treatment. Well, now that's possible with Dr.Scan&Send. Let's rewind a bit.
With Dr.Scan&Send, bystanders can scan the body of the patient. The program will direct users to take multiple scans from different angles to ensure the accuracy of the 3D model. The X-ray scans are transformed into a 3D model of the body, and with the click of a button, sent immediately to the local hospital or trauma center. Along with the 3D scan, detailed medical history previously inputted into the machine by the patient is sent to the hospital. By harnessing the power of Dr.Scan&Send, bystanders in medical emergencies will be able to lend a helping hand, and the hospital system can dramatically increase its efficiency.
So what's the science behind Dr.Scan&Send? After a user scans a patient's body, the device will be able to identify all abnormalities based on raw data from medical open source datasets provided by the World Health Organization, Cambridge Biomedical Datasets, CDC Wonder, and genome datasets, including information on genetic variations in viruses and how they affect the body. This is possible through machine learning algorithms and computer vision diagnostics based on acclimated images of the health defect from past datasets and photographs from the scans.
For devices purchased for individual users, a patient's medical records can be inputted via USB at the beginning of the product's purchase from the patient's primary medical physician. From there, the algorithm is able to recommend treatment options based on prior medical history and raw data from medical datasets. These treatments are personalized and tailored toward the patient's conditions. The scans taken by the user are formulated into a 3D model using photogrammetry, stitching together multiple images taken at different angles into a cohesive 3D model. This model is sent to a local hospital where doctors will be able to view a hologram of the body to enhance visualization and aid in intuitive comprehension of the patient's diagnosis using medical holography. Doctors can much more efficiently utilize the time between a patient's injury and their arrival to the hospital through Dr.Scan&Send, potentially saving millions of lives.
Our product exists in uncontested market space. We have combined 2 markets, the medical holography market, which is growing at a compound annual growth rate of 33.7%, and the medical imaging market, which is currently valued at $117.6 billion. Due to Dr.Scan&Send's robust affordability, it will be highly commercially viable and will be profitable in the marketplace.
Our current target customer base includes households, but we plan to expand our reach to caretakers who may be more likely to be present during a medical emergency. We also aim to work with schools and professional workplaces, since it is a very scalable solution to reduce the response time in an unfortunate medical crisis.
Dr.Scan&Send eliminates bulky equipment in a cost-effective manner to recommend personalized and accurate treatment options efficiently. By implementing existing technology in a relatively unexplored market, Dr.Scan&Send achieves differentiation and low cost simultaneously. While there are several innovations focusing on 3D medical scans or medical alerts, Dr.Scan&Send is incredibly unique in its power to combine 3D scanning and medical history transfers while remaining simple enough for an ordinary person to use. We can capitalize on its simplicity to market Dr.Scan&Send to an incredibly wide audience, ranging from corporate offices to regular households. Moreover, the personalized treatment recommendations provide doctors with diverse information to accurately treat the medical patient.
Dr.Scan&Send will sell for $500 in the market space, a price that matches its ability to get the job done and leave a lasting impact on the community.